am a medical capacity building training facilitator with Mercy Ships. I've been doing this job for 3 months, working on the checklist project. The WHO surgical checklist is a very simple tool, as you can see, completely free. We go into hospitals and we introduce the concept of the checklist to them. We are like checklist evangelists, and then we help them to adapt the WHO surgical checklist to their context. Our team members include Ali Herbert, who is Le Chef de l'Équipe. She's an OR nurse from the UK who's been an OR nurse for 37 years, and she's worked with Mercy Ships for 9 years, and she's been on the checklist project every year. Then our local doctors are Brice and Leonie, and Brice and Leonie are both general doctors, so they haven't yet done their specialisation. And they are also part of the screening team at Mercy Ships in the extreme north of the country, where they walked in extreme heat and very difficult conditions, where Boko Haram are, to screen patients, to recruit eligible patients for Mercy Ships. So they've been with Mercy Ships longer than we have. And then we've also got Graham, who is a anaesthetist from Scotland.
Mercy Ships has been teaching the checklist project for the last 3 years. Firstly in Madagascar, then in Benin, and now here we are in Cameroon. We've taught 18 hospitals so far, and by the end of this field service we'll have taught in 33 hospitals around the country, combining hospitals with poor resources as well as some of the best equipped hospitals in the country, because this project is for all hospitals that perform surgical operations. The OR is one of the most complex working environments in the world, and the WHO surgical safety checklist aims to prevent mistakes and allow each member of the OR to work to the best of their ability. The first day of our training, we introduced the concept of the surgical safety checklist to the doctors and nurses of the local hospital, and after this we perform a scenario so that they can visually see how a checklist works. On the second day we split the participants into 2 groups, and the surgeons and operating room nurses perform surgical counting training. Surgical counting is a very simple technique of counting all swabs and instruments before the operation begins and ensuring we have the same number at the end of the procedure. This prevents swabs or instruments being left inside the body, which can harbour infection and cause post-operative complications. So it's a really good technique that can prevent problems for the patient in the operating room. We also get the anaesthetists that work in the hospital together, and we perform some anaesthetic teaching for them. This includes simulation-based teaching on critical events that can happen while the patient is undergoing their operation, and we teach them about the importance of checking your anaesthetic equipment before giving someone their anaesthetic. This involves the use of lifebox pulse oximeters, which are an essential component of patient monitoring while they are under anaesthesia.
So we're about to put the checklist from the military hospital into use in the operating room. So we're just waiting for everyone to gather so that we can do our briefing. So yesterday they made the checklist, they've had a couple of practice runs with scenarios, and now we're going to use it for the first time with a real patient.
This year the team have taught something novel, and we have introduced the concept of having a team brief before each case. This involves getting all the staff of the operating team together and discussing the patient, discussing each person's role and any critical or problematic steps that may happen during the case. The checklist is not just a list of steps to follow individually, but is a way of fostering teamwork, which is important for providing safer surgery.
So here we are in the operating room of the military hospital, and we're assisting with the team here to implement their surgical safety checklist. So the operation is about halfway through, and things are going well so far, and the team have adopted the checklist very well, so it's looking good.
On the final day, we get the participants back together and present them with their checklist that they have created themselves for their hospital. We also provide them with USB sticks that has all the training material on it so that they can go on and train new staff members that arrive or other people in their region.
Favourite part of the checklist team?
My favourite part of the checklist project has been when the participants come together and try out their checklist for the first time, and we see that teamwork really in action, and they recognise that surgical safety is not just an individual's responsibility, but it is for everyone in the whole team. And when they get behind it, when they encourage each other, it's really amazing to see how it can really work. And yeah, it's very encouraging for us to witness that as part of our training.
I'm very grateful for the mercy that gift they done to Cameroon. And I think all the hospital, all the complication in our context must be reduced after implementation of this project.
We've got to see very different hospitals, from very well-off and well-equipped hospitals to really difficult circumstances that the people here are working in. And it is pretty inspirational to meet people who get out of bed every day to go to work, and that is like the circumstance that they have to deal with. And so helping them to make that a little bit better.